We haven't talked much about treatment, and one of the treatments that's sometimes feared for good reason is chemotherapy. What was your experience of the chemotherapy?
In the main, it was pretty good. I actually wasn't as sick as I thought I was going to be. That was managed pretty well. However, I think you have to acknowledge there's different types of chemotherapy. I had FEC. I know there's another one that's called FEC-T. That can be pretty aggressive. I understand it affects your nails, your nail beds, your feet. People were suffering with that, I noticed. But there are plans around that given to you, understand, by the teams there to help you manage it. On a personal point of view, and I think from a female cancer point of view, with the breast cancer, there is something that I think more women ought to be made aware of, and there ought to be more dialogue about it when you go for chats regarding your chemotherapy and with your chemotherapy nurse. It doesn't seem to be given much, placement in discussion. It's not even mentioned, and that is that, of course, when you have the chemotherapy, it affects your periods, obviously, and it'll stop them normally, depending on what type you have. And like for myself, it'll put you into a menopause situation, and it's that type of thing I think women ought to have some knowledge about, even if it's only basic, and that is the fact that you're going to get hot sweats and things and suffer with that. You're going to get other issues of a sexual nature, being uncomfortable and things. And I think that there ought to be brief mention about that, because it affects you, it affects how you feel. It can be losing sleep, it can make you feel embarrassed. You need to know some of the things of what to expect to help you prepare for that and to get help for it. I only found out when things were getting unbearable for me. It affected my relationship sexually with my partner at the time. And I think, whilst they're not going to want to go into that chapter and verse, I do think that some of those things ought to be brought out in a basic format, and so that you can go and get help and support for that. I had a really good doctor. She talked lots of that through with me. But I do think people don't focus on that side effect of the cancer and how it's going to affect women's hormone levels. Now,
I know that it's the doctor that often prescribes the chemotherapy,
yes,
but the consultation is sometimes brief. There's the chemotherapy nurses who are administering it.
Yes.
And there's also your clinical nurse specialist who may be not that involved. I'm talking about, for you, in your case, like the breast care team. So of those people, who is best placed? And there's also peer support via patients who may have just gone through it. Who is best placed to give that information that you felt was lacking in that case?
Well, I think that you've got a lot to go through when you're with your oncologist. He could do it in a bit more depth, I think, or at least bring the subject up, because, it's specific to hormonal type cancer things, particularly as well if you've got a certain type of cancer. Mine was estrogen positive, which means that I can't have any estrogen in my body at all, which will bring its own issues, and it affects you throughout your body. I think probably your nurse specialist, and maybe even do a group session of ladies where you've got a peer group person there who's been through it, and also somebody medical who can explain it and what may or may not happen, so that it's covered.